Okay, everybody, let's get started. So this meeting will be recorded for those who can't join us today, and we will also be sharing questions that people sent in to us prior. So we want to welcome everybody to CILSF's and the Enable Project's Med Talk. This is a part of our overall advocacy efforts for the COVID-19 vaccine in our community. And we want to welcome two very special guests with us today who will be sharing their knowledge with us. First, we have Dr. Cheryl Holder, who has served as faculty at Herbert Wertheim College of Medicine at Florida International University. She's been teaching the impact of social determinants of health, increasing awareness of HIV prevention, and the health impact of climate change. We also have joining us today Chika Ohaeto. She is an advanced practice registered nurse. She's a manager of advanced practice providers for Baptist Health Medical Group Primary Care. Her nursing experience spans from bedside in medical and surgery, critical care, emergency room education, and administration. She currently works as a nurse practitioner at the Baptist Health South Florida Follow-Up Care Clinic, which she started in 2012. So without further ado, we'll have Dr. Holder go first and take it away.
Hi, good afternoon, and thank you for having me. While I get my slides up and share screen, I kind of go back to the, says I'm disabled participant screen share. The host could enable my screening. Okay, thank you.
You should have access now.
Yes, I do. All right. Okay. All right. I really take me back to March of 2020. I was at a TED Med conference. I was doing my talk on climate change. And we talked about the virus. And we had this leading scientist, Peter Piot, who is a leading researcher in the world, primarily on HIV. And he talked about this virus that we had no real understanding. And he said, since it is brand new to the entire world, all 7+ billion people on this earth are susceptible to this infection. Since we have no way, we have never seen this before, and the way our body works is that our body has to see an infection, then mount the fighters to be able to fight it off so you don't get as sick and try and cure the infection, and also prepare you to fight it if you see it again. Since that virus that arrived in Wuhan, China, and now is taking over the world, we have never seen. The chances of us, if we didn't find a way to prevent it from getting in us or find a way of treating us, the entire world would be at risk for infection. So with that, we know what has happened in the year plus, that foreboding was so real and that so many of us have been infected and so many of us have died. So with that, goodness, I'm sorry here. So my slides are a little bit backwards here, I'm sorry. So when we talk about the virus, we remember back then it came out of Wuhan, and in March of 2020, what we saw, and we felt without effective vaccine or without some way of blocking this infection from getting in our bodies, we would expect a lot of deaths. And back in March, April, we were talking about 150,000 deaths. Yet we know we're at 600,000+. So what do we learn about this virus? This virus comes in the air, gets in our nostrils, and once it gets in our nostrils and through our mouth, we have receptors. It's not very hard to think about. Think about you have an open arms welcoming this thing because you've never seen it before. So it latches onto you. And when it latches into these special receptors, it gets taken into the body for your body to realize this isn't real. This is not something that I've ever seen. This is not part of me. I've got to get rid of it. So what we found out is that the dose of the virus that you get, how much that gets into your system, is what determines how sick you are. And if you look at this first slide here, on the left, I don't know if you can see my arrow, where it says low dose SARS-CoV-2 initial inoculum. And I say SARS-CoV-2 because it's the SARS virus that we've seen before, but it's a coronavirus, as we know, and it's the different 2019 was when this SARS-CoV-2 showed up. So when this low dose gets in, your body is able to fight it by making the antibodies, making the factors that fight it and kill it, and you do not get as sick. And so this is what we often find. People who have asymptomatic carrier probably didn't get a whole lot in their mouth or in their nose. And most people we now know got it from breathing it in. At first, we thought it was, you could get it from touching packages, but it's not that easy to get it. So we know now that the biggest dose you get is when somebody else has the infection, gets close to you, coughs it off, comes into your nose, or just breathing, it comes out just with breathing and it gets into you. When you get a high dose of the virus, you will get a larger reaction from your body, and it will take longer for you to get rid of this infection. And this is the high dose people who we find get very, very ill. But even low dose people, if your immune system isn't strong, if you have other underlying diseases, you can get very sick. One of the things we know with children, and we don't see it as much in children, we do see it in children, but not as much. We know the receptors that this thing grabs onto really aren't plentiful in children. It's much more common and higher amounts in adults from 12 and above after puberty. We also see more in people with obesity. So again, you understand now why some people are getting sicker, where you see it more commonly. And if your immune system is not as strong, when you get this infection and you can't mount that good response, your chances of dying are much higher. So when we think about children, again, less than 18, in the initial infection, we saw that they had much lower rates of hospitalization, much lower rates of mortality, of death. But we know they are susceptible, especially if they're in environments when there's a lot. And preventing it from getting into the child's body helps to prevent it. However, there's some children who get very severe disease, where they get a multiple immune system response. And we've had, this is about 6 months ago when I did these slides, over 110 cases have gone up. And we are now seeing in Brazil, in other countries that have this Delta variant, this new variant, the children are dying. So the virus, depending on who gets sick and who dies, really depends on how much of an infection, how bad the virus is, or we say virulent, how aggressive it is of getting in your body and wreaking havoc. The first one that we saw when it was formed in March of last year, that wasn't as bad. But when anything replicates and has to try and survive, and it's going to get into a body, and the body has some immunity because it's been out in the world, it's going to change. Just like us, if we need to survive in this world, we make some changes to ourselves so we can go out there and keep living. Our bodies grow, our bodies do different things to be able to survive. The virus is no different. It has to survive, so it changes. And every time it changes, it may become more virulent. And that's what we see with the Delta variant. So this variant that's now floating around is causing more damage to younger people. It's causing damage to people who are unvaccinated, and it is affecting our children even more. So it brings me to the vaccines. One of the things that we have done is try to find a way to get your body ready to fight. And what we've done is every vaccine that's ever been made in the past, is that we took some of the virus, some of the bad stuff, and purified it so it wouldn't give you illness, but it would make your body think that you had it so you could mount the response and be ready to fight. And that little weakened virus, killed virus, but enough of it to get your body moving is what we would do. Now, this vaccine concept in the Western world was developed after the Salk, the inventor of the Salk vaccine, read some old readings from slavery times where there was a slave who came over from Africa, and he told the master that this cowpox that they saw back in Africa, what they would do is take some of the infected skin of the person who had this cowpox, make a little cut, and inoculate it. Very, very low dose. Reading that information, and they found out, and they started doing it back in the 1600s from that information, and we saw people survive. That was the genesis of how vaccines were made, from what was started in Africa all the way through. We now found modern technology because we know we can do better. When you know better, you do better. And we have learned so much in science that we no longer have to take the actual virus or even a particle or even a piece of it. Now we can make the message to get into our bodies. And based on that message, we can tell our bodies to make something that looks almost like the virus. So your body then starts making those fighting cells. And that's what the mRNA vaccine does. It is not a new, it's a new concept, but it's based on science that's been 20, 30 years in the making. But because of our rapid ability with huge computer technology and dollars, when the governments of the world saw what was happening with coronavirus, and I told you 7.5 billion people were going to get it, we expected a lot of deaths. If you didn't do something now, you would have even more. So what the governments did was pool their dollars and accelerate the research that we do. So instead of doing step by step, every year we do a little bit of research because the government only gave us a few million, they said pour billions of dollars and say, let's move this research rapidly. Spend some money, go find some people who want to test this. Bring all the computer power to analyze the genetics of this virus. Bring it all together, and then we can make this vaccine because we knew the science, because based on Ebola, based on other SARS viruses, we had the science nailed, then we had to do the quick work. And that's why we have a vaccine. So having a vaccine in 1 year is the way I would like every vaccine to be developed from here on in. But it requires our community to say, this is what we should do because this is right to save lives. And so with that, we were able to create several vaccines. And the Moderna, which is the one that you may have heard about, that was developed by the NIH scientists, especially there's this Black scientist named Casimir Corbett, who was working on this for many years and was able to get that science to this company to make this vaccine. Again, the Moderna is the one that brings the message. When they put it in your body, it brings the message to your body to say, this is what we need to make. And then your body has the antibodies.
So sorry, doctor, these interpreters are going to switch. If you can give us 1 second.
Okay.
Go ahead.
All right. So we were just talking about the Moderna. Pfizer is similar. Pfizer got the information and they found a way of doing it rapidly. They came out first, but it's basically the same. 2 doses. They found that spike protein, and you hear about spike protein. Basically, it's the most infectious part, the message that the body goes, wow, this is not me. And that's the message that we give the body to say, start making some antibodies to this, make some fighters to this. So when you see this infection, you can beat it away. So then we have AstraZeneca, we have Janssen, we have Novavax. What they do is still take that message, but one decided, the Johnson & Johnson and the AstraZeneca, rather than putting that message in a little plastic round bubble, they decided to take a virus and travel with that message. So they said to take a little friend and take that message to the right cells in your body, rather than putting in a little plastic bubble. They both work. What we found is that when you take another virus and put it in with the message, it seems like we're getting more reaction. So you now see that AstraZeneca was not approved, but the Johnson & Johnson works pretty well. And the Pfizer, Moderna are pretty much the ones that we're going. The Novavax is coming, and that's going to be approved very soon. And it's a very similar way where it takes the same message and brings it down to that protein, and then that protein gives you the information. So it's not real, if you think about it, we're getting a message into our bodies to say, make this thing so you can fight it. And that's what we do with vaccines. That's what we've been doing with vaccines for hundreds of years. And even back in Africa, they found a way to do it. So when we look at this infection, what do we have to do? You know, I have 5 minutes, so we're going to close it now. When we look at this infection, you heard, it's floating in the air, it's coming in, you could see it touch things. So if you put it in your nose and eyes, yes, that can happen. So we say we need to put multiple layers between us and the virus. So some of the things we say, stand back, because if it's in the air and you're breathing and talking, it may not float out 6 feet. So stand back, because I want a low dose. Then we say put some mask on. So let's so happens you're standing 6 feet, something floats nearby, at least I got something to cover my nose and cover my mouth, so I'm not going to breathe it in. We say wash your hands, that in case your hands gets contaminated, you don't touch yourself and touch your nose and put it all over. So we also say don't get around a whole bunch of people that you don't know if they have it or not, because then it increases your dose. Remember, your dose is your poison. So we say stay out, get away from folks as much as you can until you have some good protection. We say test yourself, find out if you got it. So if you got it, go lock up, stay away so you don't pass this thing on. Then we say get good ventilation, because if it's floating in the air, it's better you filter that stuff out. So it makes total sense. Now the vaccines is our final thing now that we talk about, because then it gets your body, you can take care of all that outside stuff. Now your body becomes part of the fighting team, and your body then fights it off. Our vaccines work well. They work well to protect you from severe disease and death. None of these vaccines were tested to say that it won't get you infected. We know now that some people can be protected fully, but there are others who will get infected, but you won't get sick. And why won't you get sick? You should know this answer, because you already have fighting power to whatever gets in, and you get a small dose, your body will fight it off. It all makes sense. Vaccine is one of the final things we need. You clean up the air, you wash your hands, you block it off, then you get your body to fight. Makes sense why we say vaccines. Now, when we look at disabled people, we know some of the data that's been coming out, that those with long-term service support have done worse because they're in communities that are close setting. They have had disproportionate share of this infection, and they've had disproportionate share of the deaths because of their living conditions. You heard it. If you're close together, your chance of getting infected is higher. Especially we see it in racial and ethnic minorities, that they have been affected more for all the reasons I just said. There are guidelines that the CDC has implemented, and we are encouraging people to look at these guidelines and implement them, because it's not hard. Keep people clean, keep the air as clean, decrease the exposure, decrease the dose, get everybody protected, wear masks as much, get everybody vaccinated, increases your chances of preventing this infection, especially in populations that do not have the options. So when we look at vaccine hesitancy, which is what I want to get you to, interesting enough that the reasons for vaccine hesitancy among the population disabled is really no different. There are more of the vaccines in disabled people because of the long-term care facilities and their use of these services. However, when people are hesitant, many things, this was done in March 2021 at the American Association of Health and Disability, that folks don't trust the vaccine. There's concerns about safety. There's concerns there's not enough reliable information. And there are concerns that how is this vaccine affecting my particular disability? So these are very interesting points that we have to think about. then in terms of accessibility, which I know their next speaker, Nurse Ohaeto, will talk about, is some of the accessibility issues. And we know, if you're in our audience, we know that if you don't have easy transportation, they don't easily get to the site, you don't have access to reading the material easily, you don't maneuver this online world, which they often forced everybody to do. Many can't leave homes, and many weren't really get the resources to come to the home to give the vaccines, has really affected our disabled population. But there are guidelines, and we do need to come together as a community to make sure that this infection no longer disproportionately impacts all of us. Because we know this time has shown the vast disparities in care for people who are disabled, for people who are Black and brown, for poor people, for people who have lack of low socioeconomics, because these are the factors that says who gets vaccines quickly, who lives in an environment where you're so close together that you're going to get a higher dose, and who works in conditions that you can't sit home and be protected without and be able to survive. So together we can make that difference. And I look forward to hearing the rest. But I hope after this talk, it's very clear why vaccines is an important role in the fight against coronavirus, along with the distancing, masking, as we get the rest of the population vaccinated. Thank you.
Thank you very much, Dr. Holder. And now we have Chika Ohaeto.
Ohaeto. Thank you so much, Allison and Camila, for inviting me. All I can say is I wish I can clone Dr. Holder. I cloned her like 10 million times and put her in all minority population. I cannot, she's just put everything well together. And in a language everybody should be able to understand. So as Allison initially mentioned to you, I work for Baptist Health South Florida, I'm a nurse practitioner, and I happen to work with the underserved and underinsured patients. Most of my patients they do not have money at all, and uneducated, which is the worst of it, and both in health. You know, we have health illiteracy, and we also have academic illiteracy. A lot of them do not read or write. I'm going to share my population. They're made up of 71% Hispanics, and most of them are from South America. They're not Cubans. The Blacks and Blacks, I'm putting all of them together, both African Americans, Haitians, some Blacks from the Hispaniola, we have 25%, and Caucasians and others like the Chinese, I have 4%. So I looked at the vaccination rates. Our EMR, our medical record, we use electronic medical records. It gives us the opportunity to put in their vaccination, their immunization records. So when they come in during intake, we do ask them if they have received the COVID vaccine. And this is what we're getting. Only 30% of the Hispanics are vaccinated, have said they are vaccinated. 10% Blacks, 10%. And Caucasians, 50%. Remember, I told you my Caucasian population is only 4%. And honestly, I don't even know why I put 50%. I would say 80%, because to date, only 2 patients of mine who are Caucasians have refused the vaccine. Every other one that comes in is vaccinated, or once they find out how easily accessible it is, which Dr. Holder alluded to, they will go straight and get vaccinated. So why it is so, why we still have reluctance among the minority group, I do not understand. And of course, these are estimates. We didn't do any statistical calculation, but it's based on our intakes. I have written down some of the barriers I have here that I have identified as a provider. The first one, the biggest one, is transportation. I believe that if we take it to the people, if we take it to the farms, take it to the communities, they will be vaccinated. A lot of them take the buses to my clinic. And when I ask them, are you vaccinated? The first thing they ask me is, do you offer it here? Of course, that's after I've gone through this lecture that Dr. Holder just gave us in 2 minutes that I have in my office. Some of them do not know where the vaccination sites are. You will not believe a lot of our patients do not read, so they don't even know what you're talking about. All they know their little stores where they go to buy, the grocery stores, the mom and pop grocery stores in their neighborhoods. They don't go to Publix, neither do they know where CVS or Walgreens is. Sometimes they go to Walmart. So a lot of them do not go to these places. They get their medications from the local pharmacies around their neighborhoods. Again, some of them do not know that the vaccine is free. I am so shocked that I still hear, oh, but I don't have insurance. Oh, but how much does it cost? I cannot afford it. So when I hear all the all the announcements from the government and all these things we hear from them, I still keep wondering, have we really come down to our patients' level, our people, our community? Have we come down to their level? Do we need to take these vaccines to them? I grew up in Nigeria, as you can hear from my accent, and I remember as a kid going to public schools. If your parent is not educated enough to take you to the pediatrician, I remember those days, they would bring health officers to the schools to give the kids that weren't vaccinated, because they expected everybody to be vaccinated. They'll bring them to the school and kids will line up and get vaccinated. I remember they will come to the villages and you see the villagers line up and get vaccinated. So they actually took vaccines to the village. That's how they fought some of these deadly diseases. Again, I work in Homestead. A lot of my patients, like I mentioned, are from South America. They do not want to go to Publix or CVS or Walgreens because of their immigration status. They're still being haunted by immigration officers coming and raiding their homes. So they're afraid they will be deported. Few of them, I was really happy when I heard that some of the big farmers in Homestead brought the truck to the farm and got them vaccinated there. So some of my patients that got vaccinated did not go to the go to the pharmacy stores to get vaccinated. They were vaccinated on the farms. So that's for our population, those are what I am seeing. And the biggest of them is health illiteracy. That's why I made that comment that I wish I can clone Dr. Holder, because I think people, adults, we do things that make sense to us. She explained everything about this vaccine in layman's term. I happened to do some presentation to my group, and some of them, my group, I mean my Nigerian group, last Saturday, and some of them that were a little hesitant after my presentation said, okay, now we understand it. Now we're going to go and get the vaccine. So I don't think...
Okay, you can please go ahead.
I don't think that an average American has heard that presentation that she gave. And actually, apart from what I have read, I have not heard that from any provider. So I think if we start going to explain to people what this is, how it was made, so that they will not be scared anymore. You know, some of them, what they tell you is it was so rushed. And so they will understand how vaccines work and how these 2 or 3 vaccines that we're using now are made. That will make a huge difference. And as far as the other problem that we're seeing is misinformation. The media is killing us. They're killing us, honestly. And then friends and families, when you ask them, so where did you hear? They will tell you, oh, I heard from this person. Have you seen one person that died from the vaccine? No, it's just what my friend's friend told me. So it's always hearsay. There's nothing they have witnessed. They are afraid of the side effects of the vaccine. But of course, if you take time to explain those things to them, they will understand. The other barrier I have seen is political affiliation. You see that the more conservative they are, the less likely they're going to agree to the vaccine. I think what's happening is that the news that are exposed to, they are influencing their behaviors. So for the most part, I've gone through the barriers to receiving the COVID-19 vaccinations that I have noticed in my clinic. Of course, every day you see something new, you hear something new, but most of my patients, what I have just alluded to, are what I see every day. Thank you.
Thank you very much, Chika and Dr. Holder. So we do have a few questions that participants who weren't able to make it today sent in to us. So I'll read the questions. I'll start with the first one, and then both of you can answer, or whichever you want, okay? So the first question is, can I get the Delta variant if I am already vaccinated?
Based on what we see in our studies, yes, you can, especially if you're not outdoors, you're indoors, and you're around people who are not vaccinated. Yes, because they tend to have the infection at the very higher amounts. You can get it. You're often asymptomatic. So that's the one thing. We know that if you get it, you really don't feel as bad. Not everybody, remember, this is there are 100 people, maybe 2 will get very sick after they've been vaccinated, and about 90 won't feel anything at all, and then some will feel something. So it's a long range, but for the most part, we know you won't get very sick and you won't be hospitalized and you won't die if you've had the vaccine and you get the Delta variant. Yes, it can happen.
I just want to add something to what Dr. Holder just said. I do happen to round in the hospital. I work for infectious disease group once a month. And last month was the first time I saw some patients who were vaccinated and got sick from the COVID-19. And I saw 3 patients. 2 of them were totally asymptomatic. Their diagnosis is what we call incidental finding, because everyone that comes into the hospital, they swab them. So these people did not have any symptoms at all. So they weren't sick. One of them was sick. And that takes us back to what Dr. Holder had said when she started her presentation about your immunity level. For some people that are not really strong, they don't have strong immunity, or they have some disease burdens like diabetes, high blood pressure, they have been smoking, of course it will affect them more. And of course also the dose of the virus, the amount of the virus that you inhaled. So this young man was a smoker. He has COPD. All of them got it after they had been vaccinated. They got the Johnson, but his children did not get sick. The teenagers brought it home, and he was the only one that was hospitalized. The only thing is that he was not very sick. He recovered quickly.
Thank you both for sharing that. Oh,
Most people will recover even if they're sick with the Delta variant, because the Delta variant does get you a lot easier. It's more virulent. That's it's tough, but that's good news that he survived, and that's what we're finding. The folks who have died have all been unvaccinated.
Yes.
thank you. And our next question is, are the symptoms of the Delta virus the same as COVID-19?
Yes, definitely. Most people feel like they have a cold. Remember, you'll get it. Some are asymptomatic. Some are a little bit sick that they feel tired and a little cold for a day or two. Some are more sick that they get feeling weak for a week and they're out. They get headaches, they feel foggy brain, and then others end up in the hospital where the lungs are infected. They get bad pneumonia, they get blood clots, they get heart disease, and they can die. So it's a whole spectrum. But most people on a whole feel like you've been hit with a sledgehammer if you're going to be pretty sick. If you're not vaccinated, you'll feel like you've been hit with a sledgehammer. Not a great feeling, but that's what my patients say. A sledgehammer and they're foggy. So that's the description I've been told.
And if I may, Dr. Holder, there's something else I've noticed. I do at my clinic, we kind of help Homestead Hospital when they discharge patients that have COVID. They refer them to us so that we can do the telehealth. We call them on the phone. And one thing I have noticed since this new variant came out is everyone I have called had symptoms, like serious symptoms. It's not in the past. You call, maybe about 20% will say to you, oh no, I didn't feel anything, I'm fine. But everyone I have called since this new variant is sick.
Yeah, the recovery phase is longer for this population. Now, remember, there's a lot that are running around asymptomatic and infected. So the ones who get in the hospital got it pretty bad, and they linger. And this is our concern, is that they may end up what we call long COVID. That post-infectious period might be longer for this population. I tell everybody, I make my money and my life and everything I do on my brain power. And that brain fog that my patients have, that's going to wipe me out for many months till I recover. And I really can't afford that. Psychologically, in every which way. And I take care of a 92-year-old. My mother's 92. So I'm like, I don't need brain fog. I don't need to get sick. So I do everything possible. I got the vaccine. I wear an N95 mask when I'm in my clinic, N95. I do everything. I wash hands. I tell everybody, stand back 6 feet. I don't plan on getting this thing because I don't want brain fog. That's my biggest fear. Everything else I can recover, but I don't know what's going on with my brain.
Those long-term effects. Definitely.
Yeah.
So the next question we have, and this is one of my favorites that we received, is what else can we do as an organization or as a community to continue to challenge those barriers that both Dr. Holder and Chika have discussed? What can we do to challenge those barriers or remove those barriers as a community, as an organization, or yeah?
I think we need to keep taking the vaccines to them. Honestly, I don't think we have done enough. It's sad honestly, I do not think as a community that we have done enough. If we take it to them, they will get vaccinated. If we go there, like I said, the practice in my country growing up, where they took the vaccines to them, I honestly, I do not know. Now when I think about it, I keep saying maybe it was polio vaccine that they were giving them, in the quest to eradicate polio. Who knows? But I don't remember what they were, and I will see kids line up. So if they can, we'll take them to schools, take them to these farms, take them to the communities, anywhere that you see people, don't wait for them to come to CVS or Publix or Walgreens or Walmart. They may not go.
Well, I'm involved in a community effort to vaccine, and we call this alternate sites vaccinations. Now, we are trying to take it to the community, but this is where policy has nailed us. Because the infrastructure that the vaccines are released in, they come in vials about 10. Once you open the administering, you need about 10 people lined up. And the storage on Pfizer requires a lot more complicated freezers. So the infrastructure that our county has chosen, I don't know the county, the state, how it's done, they send out nurses, they send out police, they send out tents, they send out so much that it requires at least 50 people to be on that line for them to break even. So we have been having trouble getting them to come in the community for 5 and 10 people. They say it's not cost effective. They want hundreds of people lined up to get the vaccine. Our community is saying maybe 5 or 10 every day will show up slowly until they test the waters. So we definitely need our community to scream out, because the home vaccination is also not adequate. And if you're disabled, you can't go get all your transportations and you're homebound. You need better accessibility to someone to come in your home. And they're reluctant because they don't want to open up these packets and have vaccine waste. So what we have to look at is get all the way to manufacturer, and we need the disabled community, we need all the communities to scream at the Pfizers and Moderna and say, how can we repackage this vaccine so I can bring it out to the doctor's offices, I can bring it out to homes easier, and I don't need to have this huge infrastructure. So I need 100 people to line up to break even on that infrastructure to administer the vaccines. And that's our biggest problem now in Dade County, that most of the alternate sites have 5 to 10 people ready per day. They don't have 100 people or 50 people at one time. And we can't get the vaccines readily into the churches or into the community centers because of the limitation. And they want the patients to go to the CVS and go to the Walmart. And in some places like Belle Glade, if you're disabled in Belle Glade, you're sunk because there are no Publix there. There's very little anything there. So how does a disabled person get that vaccine if somebody doesn't bring it out to them? So we have to get the community and the advocacy groups screaming more and saying, get these vaccines in smaller quantities, put them on mobile units, get them in doctor's offices, and get it closer to the people.
Thank you, Dr. Holder. It's interesting to find all the inner workings, right, through all of your work of how it actually works in real life, right? The distribution and the inequity in that as well. So thank you. Our next question is, where do we both look for facts about the pandemic and benefits of the vaccine? So what are your sources that you can share?
We're going to switch interpreters.
For me, I read a lot. I follow the news, not all the news, of course, but I read, I go to CDC website. I have the app on my phone. I use that as my go-to, even though they want to politicize it. I don't buy that because luckily I'm educated, so I'm able to filter what I am reading. So I read a lot. And I attend lectures. Like today, Dr. Holder said some things I took away, and that's just how I've been getting myself updated.
Yeah, I like the CDC still, but what folks don't really understand that when science is new and evolving, you're going to get change in recommendations. So when you hear the CDC was wrong, we might be wrong, but that's what the science showed and the evidence showed. So it evolves, and we do have to change when we get more information. So I still use CDC. I use also I'm an internist, and so most of the medical societies have information. The Pediatric Association have information. The American College of Physicians have information. The American Public Health has information. The disability sites, that Association of Health and Disability, they have very good information for disabled population. And I say Kaiser Family Foundation, their website has very less political, the basic facts about what's happening and with good recommendations. I also like the WHO, because my population is poor, and the WHO takes care of a lot of poor people because much of the world. And so when it makes recommendations, it often considers the poorer population and brings alerts. So I follow the WHO, CDC, and my organization. And for kids, I do the Pediatric Association because they keep up with a lot of the PEDS recommendations.
Fantastic. Thank you for sharing those sources. Now, those are all the questions that we have received for today. So that brings us to the end of our discussion. Unless Dr. Holder or Chika, you have any other comments or?
Well, I'd love to find out, when you're working with our population, Chika, what do you use to help convince them to get the vaccine?
I think, when I listen to NPR a lot, because I love NPR. And when they started talking about vaccine hesitancy or vaccination hesitancy, one of the things they had mentioned is that people listen to their providers. And you know what? I tested it, and it is true. So when the ones that look like me will ask me, "Did you get it?" So because they want to know if I did. And of course, I got it that first week. I think I could have been that nurse that they showed everywhere. It came out on Wednesday. I got mine on Saturday, which was my day off. So I got it that first week. So I tell them yes, and all of us in our office, I didn't force them, but I told them we don't have to. So that is one way they will ask me. And even though something came up and they said we shouldn't really tell our patients, I do tell them that I got it. And once I tell them, you see now they have somebody that they trust that received it, they do receive it. I try to pitch in what your presentation, especially with building immunity, and of my patients, they have very low immune system because of their disease burden. So when I explain to them that if you get it, you're going to die, you're going to be very, very sick. So I tell them that. The other thing I explain to them, which I think has been working more than anything, is there was a young girl that came, and as soon as I figured this out, I said, okay, this is what I'm going to be using all the time. She's obese, and she said to me, "Oh no, I don't know what's in it." And she happened to ask me about orange juice, if she can drink orange juice, and I'm like, aha! I said, "What's in orange juice?" She said, "What do you mean? It's pure orange." I said, "Really? You think you can afford pure orange of that gallon?" So if we're eating hot dogs, if we're smoking, if we're drinking juice, and we're eating salami, we're eating all these things, we don't know what's in them. So what makes it different from this vaccine? And once I say that, you see them, sitting back and saying, "Oh yes, now I get it. I'm going to go get it." So I've really convinced quite a few of them, a few of my patients. And the other thing that has worked for me is my nurse, the nurse that works with us. His wife is a pharmacy tech. at Publix. So once I get one, as soon as I get one convinced, I called her, do you have a vaccine ready? She says, yes. And boom, I send them over to her right away when they get vaccinated. So and they do ask me, do I have it here? Which I wish I did, but I will send them to that. So I've been getting some people vaccinated, but I need that your lecture, because it cuts down to the everyday question they have, and it explains it in details. I think if we as providers, the problem is we don't have time. If we have time to go through the step-by-step, what you have just presented, a lot of these patients will take it.
That's what you, so it's been helpful. I also tell everybody it's the risk, the benefits, and your alternatives. So weigh your risk. And if you're worried about this vaccine, because there's so many myths, everybody now is worried about fertility and it's going to stop me from getting pregnant. And I'm like, no, that's not how the virus works. That vaccine, there are no receptors that's going to mess you up. Is it going to get caught up in my DNA? No. The mRNA is not anywhere near the cell nucleus where your DNA is, so it's not going to get there. So when we give them more understanding, the safety, and the biggest thing, they think they can fight it off naturally. And I'm like, no, I wish we could, but do you have no natural defenses against this? Because this just showed up about 2 years ago. And most of the billion people in this world has never had natural immunity. So why do you think you have so many people in India and everywhere else dying? Because there's no natural immunity. So vitamins and herbs and supplements, it's not going to save you from this infection and doing badly, or else we wouldn't have so much deaths. But we do know that vitamin D is essential in your immune system. So I encourage everyone to make sure their vitamin D levels are normal so you can help fight this infection. But if you get exposed at the right dose, you will get this infection.
Yes.
There's no ifs, ands, or buts. That's just how the virus works. And you may get it a little bit, or you may get it a lot, or you may die from it, but you're going to get it. There's just no way around it, because that's how these viruses are. And children get 7 cold viruses a year. They don't have immunity. That's why they get so many colds. This is a big old cold virus that's similar, that get in the whole world because we don't have any immunity. Nobody questions the children. Why aren't you fighting off the cold more? We don't tell that to babies. We don't tell that to children. We understand that they have no immunity. So I say that's the same thing with our body. We just happen to be adults, but it's the same factor. You would never tell a child, take your vitamins and take your this and fight off that cold. It doesn't happen. They don't have immunity. So we have to build up our immunity through vaccines. So we try, and I try my best, but there's some folks who still fear the government, fear people, fear myth. They have so many beliefs, but more and more, there are more of us out there, and the disabled communities, since you have many more health providers involved in the care, get everyone working together to have the same message. The nurses that take care of you, make sure they're all vaccinated, and the health workers, so that the message can be consistent that vaccine saves lives. And we love you, we want you to live. So it's that kind of simple.
Alison, sorry, I want to just pitch in this real quick. I also have started telling my patients now, the kids are going to go back to school starting September. So if your kid, because before they had the option of their kids staying at home, now they're going to bring this virus home. And they are super spreaders. And it just happened last week with somebody that we know. So they're going to bring them home. If there's no other reason for that alone, you need to go get vaccinated. And Dr. Holder, I don't know how the medications that we're using for COVID, remdesivir and convalescent plasma. I've been telling patients, okay, so you don't want the vaccine, but when you get sick, you're going to go to the hospital. How much do you know of those medications that you're going to get?
The monoclonal antibodies with the first type, the first variant, worked very well. And so now, because the virus is getting smarter, they have to change up the monoclonal antibodies. So if you're sick and you have any of these chronic conditions, go get the monoclonal antibodies. It'll save you from death. It definitely saves you from severe disease. They're very expensive. You're going to end up with a huge bill that you could prevent with the vaccine, but save your life, go get it. The plasma, convalescent plasma, still, because it has so much of the antibodies, because it saw different parts of the virus, the spike protein and all the other proteins of the virus. The virus has a bunch of proteins, and so it still works. But they do work in preventing you from getting severely ill and dying. So we recommend everybody who has diabetes, hypertension, HIV, chronic disease, obese, you get this infection, go check in and get that preventive medicine, because that will save your life. 65 and older also qualifies for that. But why do that? Go get the vaccine so your body does it naturally. Why take all this plasma from other people, take all these antibodies, when you can just get the vaccine and let your body naturally build its fighting power? It's so perfect that, you know, my religious people who say that the God doesn't want it to do it and God says it's going to leave something in them, I'm like, I can't imagine a better God who has told us a way of building up our own bodies to fight an infection. I just think that is pure God in giving us an ability to use our body ourselves rather than medicines and hospitals to fight an infection. And that vaccine prevents you from having to go into that other system. So it's just win-win all the way.
Well, thank you so much. And if you guys don't have any other comments, we can make our closing remarks. I want to thank both of you, Dr. Holder and Chika, for sharing your time. I know you guys are both very busy women, and I'm so grateful that you guys shared your expertise and your knowledge with us and the community. As I said before, we are going to be sharing this recording with our partners on our social media platforms. So this is definitely going to have an impact in the months to come. And I want to thank you again. And I hope this is a great connection for the both of you. Dr. Holder and Chika, it sounds like you guys have a lot in common and definitely a great professional connection. So I hope you guys get to work together in another capacity outside of this conversation as well.
Thank you.
And work with the disabled community more too.
Definitely. We will keep you on our newsletter as well. I'll add you to that so you guys can stay up to date on what we're doing. We would love to have you join our future events, not only for CILSF, but for the Enable Project, which is another coalition that we work with to try and train people on how to be accessible in the community as well. So thank you again, and we will definitely be keeping in touch with you. And we will share the recording with you as well to share with your networks.
All right. Thank you.
Thank you.
Stay safe, get vaccinated.
Thank you, Brittany and Eliani.
Thank you for having us.